Did you know that 1 in 10 people are living with diabetes? When we talk about in India, 1 in 11 people are diabetic. These numbers are surely scary and the quantum is ever increasing. Diabetes cannot be cured but can be definitely kept in control. And for controlling, you need to know these 5 key essential medical tests that we are going to discuss in this video. So let's roll. Before we begin, I would like to welcome you to the channel Lucid Medicine. I'm Dr. Rahul Joshi and I attempt to explain medical concepts, diseases, medical terminologies in a very simple way so that it is understood by all. So hit that big red subscribe button and bell icon for all the new videos. Let's quickly understand what diabetes mellitus is. Diabetes is a common endocrine chronic disorder that occurs when pancreas is no longer able to produce a hormone called insulin, or when the body cannot make good use of the insulin it produces. So there are 3 types of diabetes, namely type 1, type 2 and gestational diabetes, which occurs during pregnancy. While blood pressure measurement and urine analysis is routinely done and is very common, what I'm here to discuss today is the 5 key medical tests that every diabetic should take. Number 1, Haemoglobin A1C test or HbA1c. This test measures how much sugar is around or embedded onto your red blood cells. RBCs typically have a lifespan of 3 months and therefore this test gauges how high your blood sugar has been in the recent months. Now the normal results for non-diabetic ranges from 4 to 6%. For a diabetic patient, if it is 6 to 7%, it is said to be in excellent control. If it falls in 7 to 8%, it can be tagged as a fair control, but one needs to be watchful of it. If HbA1c result is 8% or higher, it is a sign that blood sugar is not under control. This test helps you to understand and also your doctor to manage the condition and figure out treatment plan. You should probably have this test at least twice a year. Number 2, Lipid Profile. Low density lipoproteins or LDL transport cholesterol from liver to the other tissues of the body. LDL cholesterol is therefore considered to be bad cholesterol. Your total cholesterol should be under 200 milligrams per deciliter or 200 mg per dl. Ideally, your LDL cholesterol should be less than 70 mg per dl. Your HDL, that is high density lipoprotein, should be 50 mg per dl or higher. Your triglyceride level should be less than 150 mg per dl. A cholesterol test or a complete lipid profile measures total cholesterol, HDL cholesterol, non-HDL cholesterol and triglyceride levels, which should be performed at least once a year for people with diabetes. Number 3, kidney function tests are also called as renal function test. Now over a certain period of time, living with diabetes, kidney functioning starts to deteriorate. Kidney damage from diabetes is called as diabetic nephropathy. It begins long before the symptoms show up. The microalbumin test measures amount of albumin, which is protein in urine, compares to the level of creatinine, which is a waste product that is thrown out and or filtered by the kidneys. The ratio of albumin to creatinine lets your doctor know if your kidneys are functioning properly. Research recommends getting this test at least once a year. Number 4, the blood sugar levels. Here we talk about the fasting blood sugar levels, postprandial, that is or after meals blood sugar level, and the third one is the random one. When you are on an ongoing medication for diabetes, the fasting levels should be below or less than 100 mg per dl. For postprandial normal control, the cutoff is 140 mg per dl, but it can vary from lab to lab, and thus it is a good idea to discuss with your doctor instead of worrying about it if it is different from other results. The random blood sugar is, however, the casual one, which can be done by any glucometer which you can buy. At all times, it has to be less than 140 mg per dl. A pro tip here is to maintain a diary of all your readings so that you can share it with your physician. Number 5 is the eye examination. So eye examination is a worry for eye health in many people with diabetes, especially because of development of retinopathy. Diabetic retinopathy is a condition that develops when the blood vessels in the retina, which is a portion at the back of your eyes, becomes damaged. If the blood sugar levels are not in control, it may begin to lose the vision. Get regular eye exams to catch problems early. See an eye specialist like an optometrist or an ophthalmologist at least once a year to have a dilated eye exam. Now in this exam, what happens is the doctor or the optometrist will insert or put in some drops in your eyes that will help dilate them, and that can help the doctor to see signs of retinopathy. Diabetes can affect every part of your body, from your eyes to your feet. Dietary therapy and physical activity are the cornerstones of diabetic management. I suggest you watch 5 dietary tips, which is another video which I've created. A critical part of managing diabetes is also getting routine tests and checkup that spot the problem early to help prevent complications. If you're a diabetic patient or if your dear ones have diabetes, make sure you sit down with them, discuss the optimum care possible. Time to end the video now. Thank you so much for watching. Have a great day. This is Lucid Medicine, reimagining medicine in a simpler way.